Welcome to my presentation of Simple Renal Cysts Case Study, presented by myself, Megan Ray. The subject for our case study is a 76-year-old male with a clinical history of bilateral masses, which were previously found on an ultrasound. To protect the patient's identity, this is not a picture of the actual patient, and for the rest of the presentation, we will refer to the patient as Bob. According to radiologyinfo.org, renal cysts are sacs of fluid that form in the kidneys. They usually have a thin wall and contain water-like fluid. They can be associated with serious disorders that may impair kidney function, although in this case study of Bob, and in most cases, renal cysts are a type of cyst called a simple renal cyst, which are non-cancerous that rarely cause any complications. According to the Mayo Clinic, it is not clear what actually causes simple kidney cysts. One theory is that the cysts develop when the surface layer of the kidney is weak and forms a pouch, which then fills with fluid, detaches, and then develops into the cyst. The chance of getting a cyst increases with age and is also more common in men than women. They do not typically cause any symptoms or harm. Simple kidney cysts typically don't cause symptoms. However, if it grows large enough, bursts, gets infected, or compresses the kidney, symptoms can include fever and chills, blood in the urine, pain in the abdomen or the lower back, and high blood pressure. Fortunately for Bob, he did not experience any of these symptoms. During an ultrasound, bilateral renal masses were found, so Bob's doctor ordered a CT scan for a better look. Computerized tomography, or CT, is the modality of choice for evaluating cystic renal masses for a few reasons. The administration of a contrast agent through an IV and the narrow detector thickness of less than 1 millimeter is needed to detect the small enhancing nodules. The demonstration of the enhancing areas that CT can show helps differentiate between solid components and hemorrhage or debris. Although MRI can also be used for renal cysts, they are more expensive, more time-consuming, and the images may not be as clear. Often used as a complement to ultrasound, as in Bob's case, CT can help distinguish between benign cysts and tumors, and can also show if a growth has spread beyond the kidney. About a month after Bob had an ultrasound showing bilateral renal masses, Bob's doctor ordered a CT of the abdomen with contrast. The CT technique used was a 4-phase helical CT renal imaging with intravenous contrast administered. These are his scans. This is the first portion. They are coronal slices cutting the anatomy from the anterior to the posterior portions. This would be more of the anterior. As you can see here, the kidney is here, and these are the cysts. As we go down and continue on to the next slide, we get more posterior. And as you can see, the kidney looks bigger and the cysts are more noticeable, as in here and here. The reason for this is because the kidneys are located in the posterior portion of the abdomen. The findings the radiologists found after reading Bob's scans were simple bilateral cysts, renal cysts, with the largest one being 5 by 5 by 6 centimeters with no solid renal mass. The average size for a simple renal cyst is 5 centimeters. Renal cysts are considered large when they are over 10 centimeters. Renal cysts typically do not require treatment, and this was true in Bob's case, as the cysts were not causing harm to his kidney function. However, the doctor will keep an eye on the cyst. If the kidney function is in jeopardy of being harmed or the patient is experiencing severe symptoms, treatment can include percutaneous aspiration with sclerotherapy, or PAS, which is where the doctor drains the cyst, fills it with alcohol-based solution, which causes the tissue to harden and shrink and reduces the chance of reoccurrence. There's also a surgical option with laparoscopic marsupialization, which is for larger cysts. The cyst is accessed by the surgeon with a laparoscope, drained, and then the outer layer is either burned or cut away. Unfortunately, there is no prevention for renal cysts. However, fear not, there are ways to reduce your risk. Drink lots of water and keep your sodium intake down to less than 2,300 milligrams a day. Before you go, you should know that these simple cysts that Bob had are not the same as the cysts that form with polycystic kidney disease. Polycystic kidney disease is a progressive disease that can actually lead to kidney failure. For my display of pathology, I have created pancake kidneys, one without a cyst and one with a cyst. They look yummy, and if you were here, I would insist that you try a bite. Thank you, and that concludes my presentation. Please see the following slide as long as the upload of my PowerPoint and the Word document for my reference page. Thank you.